This is Miriam Raftery with the East County Magazine radio show on KNSJ 89.1 FM Descanso, the Network for Social Justice. And today, my very special guest is Melinda Forstey. She is the Chief Operating Officer of Serving Seniors. That's a nonprofit providing services to help seniors in poverty thrive, including nutrition, housing, health, and social services. So, Melinda, welcome to the show.
Well, thank you, Miriam. I'm delighted to be here today.
Can you start by telling us a little bit about Serving Seniors, which is at servingseniors.org, and how your organization is helping meet the needs, the growing needs, I should say, of seniors?
So Serving Seniors has been around since 1970. And as you noted, we do provide wraparound services throughout the county of San Diego. And we are really focused on low-income older adults. The majority of the clients we serve are living below the federal poverty level, so living on just around $1,200 a month. And our largest program is our nutrition program, where we provide over 1.4 million meals, and many of those meals also to residents in East County.
Very good. So, folks, if you know somebody who's a senior and they're hungry, have them get in touch there. Nationwide, there's over 40 million Americans over age 65. And by 2030, with all of us aging baby boomers, that's going to more than double. They say that by 2050, 25% of all Californians will be 60 years old or older. And yet, we can see the writing on the wall, the problem. Your website notes that your median clients live on an income of about $935 a month. And yet in San Diego, the average one-bedroom apartment cost back in 2019, I'm sure it's worse now, was over $1,700 a month. So if it's $1,700 or $2,000 or whatever it is, just for a one-bedroom apartment, I mean, how is somebody on $935 a month supposed to make it? And so, not surprisingly, the latest point-in-time count done in January is showing that seniors age 55 and older now account for over 30% of the homeless people countywide. That's up from just 2 years ago. There's also a rise in seniors living in vehicles. So why are so many seniors, winding up homeless all of a sudden here? And, what else should we be doing to help them?
Yeah, well, thanks, Miriam. And what we've seen is really the root cause of older adults falling into homelessness is economic, to your previous point. So, this could be due to the loss of a job or a spouse. It could be a medical condition that folks encounter, but often it is simply increased rent on a fixed income. And to share with you some updated numbers, now in San Diego, the average cost of a studio is $2,000 a month.
Wow.
One bedroom is about $2,400 a month.
Crazy.
And so for many of the clients we work with, they live in what's called single room occupancy hotels. So about 10 by 10 feet, they share a bathroom down the hall. But for many, this was the only possible living space for them. But even these now are up to $850 or $900
That's more than they're getting. And Section 8 housing, I mean, there's like a 10-year wait for that. And I don't even know how affordable that is. But it doesn't help you if you're, 60 years old and your spouse has died and all of a sudden you can't afford to stay in your house or your apartment. What on earth are you supposed to do?
Yes. So one of the programs we are huge proponents of is the shallow rental subsidy program.
How does that work?
Yeah, so this is usually a set amount, so it could be about, say, $500 a month, and that subsidy goes directly to the landlord. So that frees up that additional expense for folks to focus on medical expenses, transportation, food, basic needs.
Now, I know San Diego County, the supervisors have approved something like that. It's not enough for everybody. You kind of have to apply and you might get it or you might not. It's a start at least. But you're saying you think we need more of that. Should other cities be doing that too? Should we be seeing La Mesa or Santee or some of these other places considering something like that?
Yes, we see this as one of the most effective prevention tools. And we were thrilled when the county launched the pilot a couple of years ago. They recently opened it up to an additional 125 individuals,
Very
but
good.
that is so small compared to the needs of the older adults in our
Yeah,
community.
some of these other cities, if they would even do it for, some of them have relatively small numbers of homeless compared to the county and the city. It seems like if they would just offer that, even a few $1,000s allocated could take care of, a good percentage of the homeless, and somebody that only has, 30 or 40 homeless people maybe, or 70 homeless people or something. Um, Tell us about, you also have, in Ramona, am I pronouncing this right? The Schmale Family Senior Residence, some kind of affordable housing for seniors. Tell us about that.
Sure, yeah. So that's the Schmalley family senior
Schmale.
residence located right downtown Ramona.
Mhm.
And that is 62 units of
Okay.
affordable housing. I should note this is a 100% voucher program.
Okay.
So these all are referred through the county of San Diego.
Okay. And how low income do you have to be to get into this? And how much do they have? So they don't pay, it's all paid for by a voucher, 100% or?
So they pay no more than 30% of their income towards the rent. And then the voucher covers the rest.
Mhm.
And so typically the income is tied to what we call area median income.
Mhm.
So typically we're looking at folks who are, making, anywhere between 25,000 up to 45,000 of income a year as the area median incomes have increased over time.
Nice. And then this, I guess it includes special needs seniors, those with disabilities, mental health issues, somebody who's been homeless, that sort of thing. And it sounds like these are nice places. They've got, a kitchen in every unit, AC, a patio, a community room you've got there, a computer lab, laundry, you know, um, we need more of that. I think. How was that funded? Was that by a private donation or was it government funded?
Yeah, it was a variety of funding. The primary funding is what's called tax credits.
Hmm.
So there is funding at the state level. And then we also utilize several different funding sources for these
Hmm.
projects.
Well, that's
But
good.
I think one thing to raise is affordable housing is by far the number one need of older adults.
Yeah.
So while we were thrilled to be able to provide these 62 units, in Ramona, there is a need for us to aggressively build as much housing as possible.
Yeah, I was just gonna say we sure need something like that in places like Lakeside and Santee, where there's a lot of homeless people and no homeless shelter at all. And it's just not realistic to expect a homeless person who lives in East County, may have ties here, uh, maybe kids in school or whatever, or in the case of seniors, all their ties and friends out here, to expect them to go to downtown San Diego into a shelter is, unreasonable. Um, you also, I understand you do some other things. You run wellness centers and classes, fun stuff. If you want to take a yoga class and you're a senior. So how do people get into that if they live out here in East County?
Yeah, so we partner with senior centers across the county, and we actually do partner with the La Mesa Older Adult Enrichment Center. So at that site, we do provide meals Monday through Friday. We provide lunches and then to-go breakfast. But we also then, in addition to that, provide home delivered meals throughout the county. So for the home delivered meal program, we serve 2 meals each day, Monday through Friday, and then double deliveries for the weekends. And we've also launched what's called our frozen meal program
Mhm.
recently. And that provides a 7 pack of frozen meals delivered once per week. And
Very
the only
nice.
qualifying criteria is that you're 60 and above
Mhm.
for all of our services.
Yeah. I want to touch on the back to the point in time count for a minute. An interesting aspect of this year's count was that La Mesa's homelessness rose by 86%, including 40% increase in the unsheltered in La Mesa. And Lemon Groves went up by 85%. I think there were also increases in places like Spring Valley, but your CEO, Paul Downey, has said that he attributes that, he believes that's caused by the city of San Diego, you know, having a ban on camping. I mean, it makes sense if you can't camp out and you're homeless in San Diego, what are you going to do? Um, a lot of them apparently are coming to East County. So is this, should East County's homeless problem really be considered a problem of the whole county and the city of San Diego too? Should they be doing more than they're doing so that we don't wind up with homeless San Diegans winding up in La Mesa?
I think we all need to take a hands-on approach as the community. And we absolutely do think the growth in the communities of La Mesa and Lemon Grove are directly attributed to the encampment ban. You may notice, a lot of more unsheltered folks, particularly around the trolley lines. But to your earlier point as well, Miriam, I think the statistics speak for themselves, where in every community, there's a lack of housing affordability.
Correct.
That's why investing in more housing, in these prevention programs, and in services to folks who are currently unsheltered are absolutely critical.
Yeah, exactly. Exactly. Um, what else, what else can be done to prevent people from seniors from becoming homeless in the first place? Because once you're homeless, it's really hard to get back into housing. You got to come up with first and last month's rent and a cleaning deposit. And often once they're on the streets, you've got, you know, the county and the state and the federal government picking up the tab if somebody is making repeat trips to the emergency room because they've got, uh, exposure to the elements or maybe illnesses or infections that they wouldn't have gotten if they'd been in a safe place. Or law enforcement in some cases winds up dealing with them. So what else should be done, especially in the case of seniors, to just prevent them from becoming homeless in the first place? You mentioned shallow rent subsidies. Is there anything else?
There is. So there is something called diversion, and this can be one-time funding that someone may need. So for example, someone has to go to the hospital. They leave the hospital and they have thousands of dollars in medical expenses.
Yeah.
Rather than having them go bankrupt and rack up all these credit cards,
Can
if
you
we
even do that anymore? I thought that medical bankruptcies were eliminated a few years ago by Congress, which is probably part of the problem.
Sure,
You know,
sure. But even, to have to then borrow money from other folks, if we had additional funding for these one-time expenses.
right. Or it could be a vehicle. Maybe they need if your car needs a transmission that's thousands of dollars or, you know, something like that.
And also we would also point to there's other programs such as family reunification.
Mhm.
So many of the older adults in our community may have family members that they have not connected with, and that could be local or that could be in a different part of the country.
Yeah.
And we have seen some success with reunifying people with their siblings, their children, other extended
Yeah.
family that
Alcohol
can
has
really
a
do that.
program like that where they check to be sure the family actually wants them back and they partner with the Salvation Army and buy them the bus ticket. Someone's there at each bus stop from the Salvation Army to make sure they don't wander away. Maybe you've got someone with, dementia issues. And then they do call and check and, a few weeks later with the families to see how things are working out and be sure that the person is okay. But you're right, that's an important part of it.
And I would also add, we need to also look at programs like shared housing. So,
Yeah.
we know it's going to be easier if you're pulling your money together on that two-bedroom apartment rather than trying to pay that big price tag for a studio
Exactly.
one bedroom. And so this could be older adults finding roommates their same age or could be of a different age. We know that
Yeah.
there's programs out there that pair older adults with younger individuals that work out beautifully in this community.
Yeah, I've heard of programs some
Mhm.
places where, obviously it wouldn't be for everybody, but maybe for someone who's willing to trade some kind of service for a rent, reduction. Maybe they're willing to pet sit for somebody or, you know, do cooking or something like that. So I
Yeah.
think, yeah, we have to think outside the box a little bit on some of this. So, um, what else would you like our audience to know about serving seniors or the needs of seniors here in San Diego County that I haven't already asked you about?
I think it's really critical as we're looking at the issue of older adults experiencing homelessness and that are housing insecure. These are folks who have worked their whole lives, they had savings, they contributed to our society. And just due to one aspect or another, all of a sudden, for the first time in their lives, for many of them, they are in a really challenging situation where they're finding themselves on the streets for the first time. Another data point I always like to point to is that there's a misconception that folks experiencing homelessness moved here. Well, actually, I think it's around 89% became homeless in San Diego.
Right. They were
So
here all
as
along.
a community, we really need to really continue to step up and provide those wraparound services.
Yeah. And I'm really concerned about the seniors who may be starting to have health issues or memory issues. I've heard some horror stories about, hospitals dumping patients in wheelchairs and walkers, in the middle of the night. I mean, it's crazy. And then some shelters, I guess, homeless shelters, apparently, if you're over a certain age, they're not allowed to put you in an upper bunk because of fall risk and safety risk. But if all the lower, even though it may show on paper that there's, beds available, if they're on the upper bunk, they're really not. And so people get turned away. Do we need to do more as far as homeless shelters, at least as a temporary stopgap, that are suited to the needs of seniors? And what about those with memory care issues?
Yes, to all of the above. So what we've learned really within our existing shelter system, we don't have the services and staff in place to address the needs of older adults.
Mhm.
Many of our clients that we work with have stayed away from shelters due to fear of violence, to drug use. And then there is a huge gap as well for folks that may need additional assistance. Say if
Mhm.
they do need assistance with dressing or bathing or being fed. So we really are also pushing for more shelters to be age friendly, to be accessible to older adults, and to really be able to respond to their needs.
Yeah,
And I would
it
like to
almost seems like we need like dormitory type, situations. Or why is it that, if you're wealthy, you can go into a retirement hotel somewhere where they do everything for you, but it seems like maybe we need a version of that for any senior that just is not able to care for themselves completely anymore, where maybe you have your own little apartment for privacy, but there would be like a dining commons area where you can go for the shared meals without having to pay, $5,000 or $6,000 or more a month for this because, most seniors, there's just no way that they can afford that.
And I can share, in terms of that model within all of our housing sites, in
Mhm.
addition to the actual housing, we do provide those wraparound services
Nice.
at each of our housing sites.
Yeah.
One additional gap I would love to point out is the
Mhm.
need for more recuperative care. And so that is when an individual is discharged from the hospital.
Yeah.
And they simply have nowhere to go, right? The shelters aren't equipped to take them, and so they're finding
Uh-uh.
themselves on the streets. So
Sometimes I'm
having
hearing they're dumping them in like hospital gowns and fuzzy slippers even. It's just, beyond cruel.
Yeah, yes. And we're seeing this. We've had folks, be dropped off at our wellness center.
Mm.
And so really having more recuperative care where you're able to have that transitional place
Right.
while folks are recovering and then provide them with those services to ultimately transition them into permanent housing, or if they need a higher level of care, make sure that it's a suitable long-term solution for them.
Absolutely. So the meals again, back to the meals, are those delivered to the house? Or is that served in a communal setting? Or how do people, if they just want to start by getting some meal help to help on their budget, uh, how do how do they get that?
Yes, well, I welcome everyone to our website, servingseniors.org.
And is there a phone number? If anybody here doesn't have internet, any of our radio listeners, is there a phone number they can call?
There is. So 619-235-6572. And we actually provide meals both at senior centers
Mhm.
across the county. So as I mentioned, La Mesa is one of them.
Yeah.
And then for our home delivered meal program, we have a team of drivers that do make these deliveries Monday through Friday.
So if
So
someone's not mobile or they don't have transportation, you can get it delivered to your house. And then the activities, what are some of the activities that you mentioned you have that where you partnered with the city of La Mesa? Are there any others in East County or is that it?
So La Mesa is our main on-site partnership in East
Mhm,
County right now.
mhm.
But for folks, if they do find themselves downtown or at any of our other locations, we certainly welcome folks to our Gary and Mary
Fantastic.
West
Yoga, what else? What other kind of things can you find in at the La Mesa Center?
Yeah, so that, and I should just note that is the city of La Mesa that's offering
La Mesa
that
Senior Center.
programming.
Okay.
Yes, so
Okay. So you
I
just
believe
partner to
that
refer people to that.
I believe there's fitness there. I know that they have other community partners that are there. But we also have a robust team of social workers, and we
Mhm.
do have one that is dedicated to folks who are receiving our nutrition services.
Very
So
good.
that is open to folks in East County as well.
Mhm.
So if there is a social service need, we can certainly provide that support.
Oh, that's fantastic. Listeners, if you just tuned in, we have been speaking with Melinda Forstey. She is the Chief Operating Officer of Serving Seniors. You can find more about them at servingseniors.org. Melissa, I want to thank you I'm sorry, Melinda, I want to thank you very, very much for joining us today on the East County Magazine radio show on KNSJ. I'll let you have the final word here.
Great. Well, thank you, Miriam. It's been a pleasure. And as noted, if you would like to learn more about serving seniors or get involved, there's many ways. We welcome you again to our website at servingseniors.org and just, love serving this community as a whole. Thank you.
Fantastic. Keep up the great work. There's such a need for it.